Uganda talk show. This is the final band. After 5 episodes, we've definitely been having a focal point on the fight and management of COVID-19 in the country. It's not only the duty of the government, nor is it the duty of the Ministry of Health, but it's also the duty of other party players in the sector, especially the private sector, to help us overcome the surge of COVID-19. Now, looking at the statistics, just as of the 24th of June 2022, you do have statistics that were released by the Ministry of Health. And looking at new cases, we now have 85 new cases that have been registered, and that gives a test positivity rate of 3.3%. And then when you look at the recoveries, we are now looking at over 100,000+ people that have recovered from COVID-19. We've only registered 1 death between then and now. But then again, I think also on the positive end, many of you have actually been engaging in the vaccination drive, and we're having over 21 million Ugandans now that we can say are vaccinated of COVID-19 for the first jab. And you get to look at accumulative cases, 167 over 400. Now that's interesting statistics getting into this conversation. But COVID-19 messages of hope are being brought to you by MILDMAY Uganda in partnership with the Ministry of Health Uganda. And we are having panelists that are giving us the final bend here. Our focal point is going to be very simple: engaging the faith leaders and technical teams, and in particular health workers, in sustaining SOP's vaccination as well as a healthy living to be able to boost the economy of Uganda. At the end of the day, health and economy are in partnership in one way or another. Now, to have these conversations with me, I'll start from my extreme left. I do have Dr. Doreen Sechibombo, who is the head private services, MILDMAY Uganda Hospital. Good morning to you, Dr. Doreen.
Good morning, our viewers.
So, Dr. Doreen, I want to start from you and find out, since 2020 and the surge of COVID-19 here in Uganda per se, under MILDMAY Uganda, the hospital, what are the statistics that you have had in the first wave, second wave, and currently?
Okay. Good morning, our viewers, once again. At MILDMAY Uganda Hospital, the numbers of COVID, we usually track them on a weekly basis. In the first wave, we had about ranging about 100 per week, and then in the second wave, that was the worst wave, we had about 200 testing positive per week. We had our positivity rates ranging from initially 5 to 20, and then our highest, I think, was about 28 in the second wave. And then in the third wave, in the first and second wave, we had a number of patients who needed admission, and our highest admissions were in the second wave. And then in the third wave, majority of the patients were outpatients, and I think we had about 2 or 3 admissions, and most of the patients recovered. In the current season, the first few weeks of May, we're in June. The first few weeks of May, we are going to June. The numbers were quite high. Our positivity rate had raised to about 3%. But as per last week, our positivity rate had sort of gone down to 1%, whereby we have 2 to 3 cases per week. And majority of them have had mild to moderate symptoms, and we've been able to manage them from home.
Okay, all right. Yes. Well done, Dr. Doreen. Next to Dr. Doreen is Mr. Emmanuel Omoni, who's the laboratory manager still at MILDMAY Uganda Hospital. Good morning to you, Mr. Emmanuel.
Good morning.
Now, in regards to laboratory management, and as far as COVID-19 is concerned, one of the things that stop people from coming in for tests is the fear of and the surge at the same time, and how they would manage thereafter in case it's at whatever stage it is that they come in to test for COVID-19. Under laboratory management, how have you been able to encourage people to actually take these tests?
Okay, thank you very much for that question. Yes, people usually get so scared when they test positive for COVID. COVID is a disease that is manageable. When you're positive, we know that there's no direct treatment, but there are treatments, there are managements that are there in place to make people recover, and many people have recovered from the statistics that you've seen. And of course, there are tests that we can do once you've developed symptoms and you find that you're positive to COVID. There are PCR tests, the antigen tests that one can do, and these are there are labs that are accredited for this testing. And so once you find that you've developed the symptoms, it's important that you walk, know your status, because again, you can't be managed when you do not know it's COVID, because this infection has symptoms that are close to other infections. The symptoms are close to malaria, they're close to TB, so it's important that the laboratory actually does a diagnosis to know whether it is actually COVID, so that you're given the right form of management.
Okay, all right.
Yeah.
Thank you so much, Mr. Omonyo.
Yeah.
And next to Mr. Omonyo is Mr. Tadeo Atuhura, who's the Communications and Partnership Manager, MILDMAY Uganda. Good morning, Mr. Tadeo.
Good morning.
Now, you have been here since inception of this program. This is the 6th episode, and the journey has been focusing on messages of hope, especially through faith leaders and then health workers in particular. Just give us a summary of the walk down the journey.
Thank you very much. Great morning to our viewers, and thank you for this very strong partnership, and special real regards from the hospital, and also MILDMAY Uganda as an organization. And also, of course, you know, we are now a group. We are doing research, we are into training. We have a MILDMAY Institute of Health Sciences, where we're training young people to become leaders in health profession. And then, of course, we have the hospital that is doing the direct management of these. Now, you asked something very brilliant about where have you been, what has happened, and where are we going to. The COVID-19 pandemic really cut the entire world off. And like you know, it was just beyond Uganda. It's a global issue. And I must say that COVID-19 is still here by the statistics that we've just read. Now, one of the things that we, in partnership with different partners like CDC and PEPFAR, in support of the Minister of Health, came up with an innovation around engaging faith leaders. It's been a great, inspiring journey that faith leaders are the champions of making sure the message goes out to our people. You know, like I've said on the previous engagements, both here and beyond with different media platforms, the faith leaders are unique in a way that they have an audience that is steady every day. They're interfacing with somebody either individually or as a group. Today is Monday. Faith leaders were meeting different people on Sunday. The Seventh-day Adventists were engaged on Saturday. The Muslim community was engaged on Friday. The other day we just had Namugongo, the pilgrimage Namugongo, and the very big crowds. So if the faith leaders are not engaged, it becomes quite a little bit tricky to have the impact that we are registering today. And through engaging the faith leaders, first and foremost, empowering them, making them understand about COVID-19, making them to know how to manage it, making them to understand how do I engage a patient, for instance, if they have been diagnosed with COVID-19. But above all, the other aspect is into how do they get involved in a mobilization. And here we're talking about vaccination. More specifically, you know, the entire country, Minister of Health is rallying us around making sure that people get vaccinated. At our hospital, I'm proud to say that we are vaccinating now through the support of Wakiso District. We're vaccinating every Monday and Tuesday, 8 to 3 p.m. We have Pfizer now, I think.
Yes.
Yes. So it's one of the ways through which we can be able to have the fight against COVID-19.
Okay.
So with the faith leaders have been able to provide this leadership. They have mobilized their people to get vaccinated, but they themselves have been vaccinated, and that has inspired so many people to get vaccinated as well. The journey has been quite inspirational. It's about working together, but also very fundamental, it's sustainable. Because there are things where the hospital may not be down in the communities, but the faith leader is there.
They're always
there, and they will be able to carry out the message. One of the things that is very unique that the audience might want to know is that whenever we have any challenge, we call up the faith leaders. Similarly, when we have celebrations, we call up faith leaders. There must be a faith leader. If somebody is going to graduate, always there's somebody to move a prayer. If somebody is going to achieve, maybe it's a wedding, there must be a faith leader. So, and at all these points, the faith leaders have remained really in the leadership position. They will go with their mask on. We got an example like in one of the places where we're in Mitiani. And the reverend was telling us, I reached in the place and I realized that I was the only one wearing a mask. But I stood and I said, I must be able to continue wearing this so that people can get to know. Now, the rest of the other people said, yes, now, Reverend, now you're putting on a mask. It means this thing is very serious. So it's very important that at sustainability level, we have seen this message to continuing and continuing. And we want to say that with the support from Ministry of Health in terms of messaging and guidelines, it is very pertinent that we continue engaging the faith leaders to ensure there is a change. This surge that is coming up, because when you start recording 85 cases, that is as per 27th, that is yesterday, and one death, it means that we're going to have many more. Now, with the kind of complacency which is currently happening, really do you see that people are really moving around with their sanitizers, but also in terms of wearing of masks. In some places, actually, people will tell you, no, I think the economy is much more harder than you talking about COVID-19. But I will tell you, from management, what we have seen in terms of managing these cases, it's very expensive to manage a COVID-19 case on admission, what you would call inpatient. It's very expensive. That's why people are clamoring the other day of oxygen, of what, when there was that surge. So it may be much more higher for you to manage a COVID-19 case than you accessing salt, maybe soap at a higher price.
That's true.
So you'd rather invest in making sure that, one, you are following the SOPs, wherever we are, is to make sure that you have your mask on, is to make sure that you are sanitizing, you are keeping a social distance. But above all, reflect on science. Science has proven that when you get vaccinated, the chances of going to severity are really very low. So it's very important for us to have that very clear. And that we have seen even when we have been engaging the faith leaders.
Okay, thank you so much, Mr. Tadeo. Conversation on COVID-19, messages of hope, and I'm your moderator, Priscilla Regina Naloga. And of course, from the background that Mr. Tadeo has given us, of course, he has ticked off the views and the brief objectives of MILDMAY and their participation in the positive message they're sending out against COVID-19. He has also answered the question on why MILDMAY, in particular in Uganda, is actually leading the fight against COVID-19 through faith leaders. He has mentioned that every event, be it good or bad, there's always a faith leader, there's always faith representation in one way or another, and we always seemingly are more willing to hear the faith leaders than we are to hear anybody else. And so through them we can actually continue campaigning with the sustainability message about SOPs, as he has mentioned, vaccination drive, which is all over the country, and of course healthy living. Now, speaking of which, I'd like to turn to Dr. Doreen and find out, why should we refer patients of COVID-19 to the hospital now? One of the things that came out of COVID-19, you know, the two surges, was home treatments, home remedies, and people were self-medicating. Steaming, as you can call it. And so people over time have adopted this kind of quote-unquote healthy living to either guard themselves against getting COVID-19, even those who have COVID-19, rather than come to the laboratory, come to the hospital, they'd rather assume if it's COVID-19, do ABCD squared. So why should we have reference to the hospital?
Okay, thank you, Regina. Our viewers, it's quite important to, like Emmanuel said, when you have symptoms, fever, cough, sore throat, joint pains, some of the combinations are different. It's not only COVID that causes those symptoms. So it's very important for one to be able to go to a hospital, to have a thorough examination by the doctor, and then have lab tests done. These lab tests, when the doctor examines, he has an idea of which possible diagnosis. For example, if you have fever, you have cough, you could have a pneumonia, you could have malaria. So when the doctor examines you, they are able to see and then have those differentials. So after he's made the differentials, they ask for tests, and those tests, COVID is just one of them. So there are several tests that the doctor may request. And based on the results, the doctor is able to confirm that you have COVID or you don't have COVID. What the doctor does in the assessment usually is to assess the severity of the condition you have. And based on the severity and the results, then the doctor is able to decide on what kind of treatment you need. Is it home treatment? Do you need close observation? Do you need to be admitted? And some of the challenges that we have faced in this season is that home treatment. Majority of the people say, now this is ABC, this is what I need to do. So they begin management at home. By the time they come to the health facility, their condition is so critical, their lungs are severely damaged, their other organs are severely damaged, and the medical team can only do so much, and we end up losing the patient. So the key thing is to, or you could find that you didn't make the right diagnosis. Probably someone had pneumonia, or probably they had malaria, which you missed out. So, and then also if you've self-medicated and your condition worsens, you may fear to go to a health facility because you're like, now I'll be blamed, what did I do? But then if you had an initial contact with a health facility, you will be more comfortable. Some health facilities like MILDMAY, we have a patient helpline. You call on the helpline and say, this is how I'm progressing. What should I do? So you're given the right guidance. So it's very important to go to a health facility, get checked by a doctor to assess the severity of the illness. It may appear simple to you. Your symptoms may be mild, but when the doctor examines, it's more complicated than you thought. So it's very important to get advice from a medical personnel on what medication, whether to be managed at home or to be within the health facility.
Okay, all right. Now, over the stretch of the 3 years of COVID-19, we have seen different classifications of what could be signs and symptoms of COVID-19. Could you give us the current breakdown that you would consider, at MILDMAY for someone to actually think of coming to the hospital to test for COVID-19?
Okay, what I would say is that some people at times are symptomatic, but the common symptoms, they keep changing from season to season. But some of the salient symptoms could be fever, a sore throat, flu, cough, chest pain, difficulty in breathing, body aches, muscle pains, and also feeling of being unwell. Those are the major symptoms that usually present. So like we said, they present like other conditions. So yeah.
Okay, all right. I'll turn to you, Mr. Emmanuel Omonyi. I want to find out from you the importance of laboratory in terms of the fight against COVID-19. So many people, one, of course, people fear the needle pricking them. That's the reality. But then again, more so in terms of management, and I'm talking about from the time you take the test to the time you get to deliver the news, just in case someone is positive. Under AIDS, there's always that preparation conversation before you deliver this kind of news. And given the fact that each one of us has actually lost a loved one, a friend, a comrade, a colleague to COVID-19, we know the impact of it already in our personal lives. And so there's always that fear. There's always that stigma that just in case. And so already mentally, people are challenged. So under laboratory management, how do you what's the importance of, your services, and how do you actually deliver your services to the people?
Thank you very much. And I think that's a very important question. Again, the laboratory is the cornerstone of any, form of medical treatment. Before once one gets treatment, you need to know exactly what kind of infection one has gotten. And so it's very important, much as one presents with classical symptoms, that this is probably looking like COVID, it's important to really zero down to what is causing that kind of infection. So for everyone that probably gets symptoms, it's important that they walk to a health facility and know whichever kind of tests that they're required to do, so that they do the tests, that the doctor eventually knows that, oh, this is the infection, and then treats this person with the right form of treatment. The effects of late presentation for diagnosis are so many, because once you start treating the wrong thing, these drugs are also toxic in a way. it means you're affecting your organs. But as well, the infection itself, once it delays and we are not targeting the right infection, then that's why we've seen many people lost their lives. Many people were hidden somewhere at their homes, taking Coartem, thinking they're treating COVID. They're taking maybe amoxicillin or herbs somewhere, and these herbs are probably also detrimental. So it's very, very important. These drugs are toxic. It's important that we selectively, knowing from the laboratory that this is the infection, for you to get the right form of treatment. Yeah.
Maybe just to add on,
Yes,
maybe you asked, just add on to what Emmanuel has said. At the beginning of the pandemic, or the first pandemic, we would get positive results. Usually, you know, if someone comes in directly to test, for example, they don't want to see a doctor, usually you'd find that you'd give them the results there and then. And then we found that people would get shocked, people would be angry, people would be... So with the lessons learned, we changed the procedure. For everyone who turns positive, they must see a health worker, whether they look okay, whether they are very sick. So in our procedure, once you test positive, you have to go to a doctor to be able to explain the meaning of the result, to be able to explain to you what your condition is in relation to that positive result, and to be able to counsel you on what you need to do. Like follow the SOPs, what each medication is going to prescribe is for, the risk factors, probably what are the signs if you worsen, what do you do. So currently, when someone tests positive, they need to see a doctor to be counseled and given the right guidance on what to do about that result, and also to calm them down, to know that it doesn't mean you're going to die. It's a death sentence. You know, when you'd be told you're COVID positive, you would have sleepless nights, and some people would be actually severely affected, whereby we would even need to refer them to a counselor to give them that additional support. Sometimes you'd find some would be rejected by their family members. You know, we had that kind of stigma come up. Though now more people are accepting it, but we needed a number of people tested positive, needed that psychosocial support to be able to be received by their family, but also to know that together we need to fight this.
Okay. All right. Still, Mr. Emmanuel, I want to find out, of course, the generic testing would be the rapid testing. But then I know that there's alternative testings just in case the person comes in when the case is a bit severe. So which are those alternative testings that are considered at MILDMAY Uganda?
Okay. Like you said, there's the antigen testing. The antigen testing majorly looks at the proteins of the virus. It is a more simple technique. Within 15 minutes to an hour, you have your results. Yeah, that's the quickest, and usually it's not very accurate compared to the PCR. The PCR is the other alternative. Yes, it is good, especially if you present with symptoms, signs and symptoms. At that point, the virus is active, and it's easy for us to be able to detect that you have the infection. The PCR is a more expensive technique, but as well very sensitive, meaning that even when you do not present with symptoms, we're able to actually know through our lab, through the procedures, that you actually have the infection. It is very costly, and it's also very labor intensive, and needs a very skilled worker to be able to run such a tests.
What are the costs that we're talking about in this economy as we have in crisis?
Yes, an antigen test of late, I think you can even have a test run through 50,000 Uganda shillings. But with the PCR, you have over 100,000 Uganda shillings, and many of the labs will determine the price based on the, on how fast you would want this result. Some of the clients would want results probably within 1 hour, 1 hour, 4 hours, or 12 hours. So depending also, that will determine the costs.
Okay.
Yeah.
All right. Thank you so much, Mr. Emmanuel Omoni, who is a laboratory manager with MILDMAY Uganda. Now we take a short breather, but this talk show does continue. Don't go away. The MILDMAY Uganda talk show does continue. My name is Priscilla Regina Naloga, and of course we are having a conversation, COVID-19 messages of hope. MILDMAY Uganda has been engaging faith leaders on COVID-19 messages of hope, and of course one of the focal objectives of these talk shows is to ensure that there's sustainability in terms of implementation of COVID-19 SOPs. You're looking at vaccination as well as health living. Tadeo Atuhura, who's the Communications and Partnership Manager, MILDMAY Uganda, is with us for the 6th episode. And then we are also joined by Dr. Doreen Sechibobo, who is the Head Private Services at MILDMAY Uganda Hospital, as well as Emmanuel Omoni, who is the Laboratory Manager at MILDMAY Uganda Hospital. Now, I will turn to you, Dr. Doreen, and find out from you, what are the other services that are being offered away from COVID-19 at MILDMAY Uganda Hospital?
Okay, thank you very much, Regina. As MILDMAY Uganda Hospital, previously we used to be an HIV specialist center offering care, treatment, training and research. But since 2014, we've been able to roll out into a general hospital that manages services, that offers services beyond HIV. And here what we are looking at is a number of services for the children that range from vaccination, wellness checks, to managing whatever conditions that they have. And then for the adults, male and female, we're able to offer care across the spectrum, from wellness to acute care, chronic care, to management of the elderly. You know, currently we have more older people than before. Many of us have our parents to take care of who are elderly. And then we have surgical services, where we're able to manage from the minor to the major. We also have orthopedic services. And then we have obstetrics and gynecology. This is where we manage mothers who are pregnant from antenatal to delivery. We're able to manage the complicated deliveries as well. So we have a theater as well. So we're able to offer care to the general public, comprehensive care. We are open 24 hours, and we offer both outpatient and inpatient care, acute, emergency care, as well as chronic care.
Okay, you did mention research and training. Are those still continuing programs under MILDMAY Uganda?
Yes, like Tadeo mentioned earlier, we used to be just one HIV facility offering care, but MILDMAY has been able to expand. We are now a MILDMAY Uganda group with 4 entities, where we have the hospital, where we have a research institute, where we have a training institute, and we also have the programs that help in health system strengthening for HIV care in about 9 districts within central Uganda. So we've grown that big to be able to ensure that we ensure sustainable health care to the general public.
Okay, all right.
Yes.
Tadeo, please tell us more about the research and the training arms that you have under MILDMAY Uganda.
Yes, so thank you so much, Regina. And I think the Dr. Doreen has alluded to that. We have the MILDMAY Institute of Health Sciences. And you know, whatever we're talking about is linked to a bigger mandate of communities transformed for sustainable health. And that's why even COVID-19 comes in here. But like you know, for you to be able to have a great service of COVID or to access good health care, you must have a good health care provider. So there must be that person who is well trained to be able to deliver. I'm talking about a health worker in a layperson's language. So we have MILDMAY Institute of Health Sciences that is basically looking at that. And we have 4 schools, School of Medical Laboratory Technology, Clinic Officers, School of Nursing and Midwifery, and Applied Sciences. Now, like you're aware that in health you must have evidence. Evidence towards whatever we want to do in terms of healthcare, in terms of health policy, in terms of having evidence-based decision making, and that calls in for authentic research. And so we also have an entity, the MILDMAY Research Center Uganda Limited, which is basically looking at research. And we're into health again, with different partnerships with the Ministry of Education, Ministry of Health, Ministry of ICT, where we can be able to partner together and bring this agenda forward. So in terms of COVID-19, even linked to this, we have got some studies that are under our research center that are looking at different areas.
Could you tell us some of those studies that you're referring to?
Yeah, more is in terms of the infections. It's also about attitude and behavior linked towards COVID-19. You're aware that it isn't very easy to tell somebody to wash their hands. They will ask so many questions. And so, but also looking at how does this then, these different attitudes, different behavior is able to be discussed, as well as looking at how does it impact on some of these models we are talking about in terms of preventing COVID-19. But also, it's also to look at the statistics basically and say, when we look at the first surge, look at the second surge, look at the third, where, you know, these waves. And right now we're talking about a fourth wave. What impact does it have in terms of management as well? What about complacency? Those are some of the different variables that really our research looks at. Is it that the people failing to put on masks is actually linked to the surgence of the numbers that we are seeing today? Is it about the way how we live? Is it about the general wellness? Doctor was talking about wellness. There's a whole component around nutrition and how people live, the lifestyle. Is it linked to that? When we had the first COVID-19 lockdown, I think you saw there was a lot of people on the streets running. Everybody, I think, was jogging. You know, they would say, let me jog and make sure that I'm healthy. But also we are asking ourselves, could this be one of the best practices that can be taken on? Beyond just the scare of COVID-19, Regina, what is your health style? What do you eat? How do you live? Did you only get stuck to having to run the whole NTV news program and all? What else do you do? How many times do you drink water? How many liters do you drink? When do you do your fitness?
They tell us to take 8 glasses. Of
8 glasses. But that also depends on your body mass index. But we have also realized that there are other core things that we need to engage in.
What I pick from what you're submitting is that actually the general public picks up on what should be quote-unquote good intentional remedies that are supposed to be medically advisable. However, consumption of it is wrong because I've talked about the 8 glasses and you say it according to the body index. Now, someone doesn't know that there's consideration of the body index in relation to how much water you should be taking in. Yes.
And Regina, that's what pretty that Dr. Doreen is talking about at the hospital, the MILDMAY Uganda Hospital, where there is that awareness and wellness that people are talked to, people are educated to, or patients are educated to. You talk to them about just living style. You know, we tend to think that everything should be really taken to the hospital. But we've seen situations whereby people present to the hospital and they are fatigued. They are fatigued, they have not had any rest. When you check through and say, when did you last take a glass of water? At least for you, I've talked about 8 glasses of water. But when somebody says, no, I really take water. And yet we know 75% actually of our bodies need water.
Another will say, I substitute water with tea. If I take my full flask of tea, I've taken water.
Exactly, which is also very different. Because, and that's what we are really looking at. That when your body immunity is strong, you have been vaccinated. Even when you get COVID, you have got that strong immunity that can be able to fight back. But we have seen situations whereby you have spent weeks without eating because you are trying to, some people say, well, I'm getting the right figure. Then you have people who are really snacking a lot. I just take my snacks and run back. We've got this work schedule that you don't have time to rest. You don't have time to rest. You go back home, maybe at about 10 p.m. Now there's no longer curfew. And you sleep at 3 a.m. Now you're waking up at 5. You get to work. That becomes your daily routine. The body is trying to break down without your awareness. Now when it reaches that time when you get even a simple maybe flu or what, you end up...
It will put you down, now, which shouldn't be the case.
The worst thing is, even when you get this, you don't come to the doctor.
Hospital.
What do? You say, let me go.
Self-medication.
Yes, let me now start by let me have my herb here. Or I can walk to the pharmacy. I walked to the pharmacy and picked something. But also steaming. And that's what we saw. in all these COVID-19 management, people come to the facility when they have been doing self-medication.
Dr. Doreen, what has been the impact of the fight against COVID-19 and self-treatments, self-medications?
The impact, in one way or another, there's some, they are both positive and negative effects. The positive is that once people have known that if you have COVID, you should have a well-balanced diet to ensure you have vitamins in your diet, and then also be able to get the emergency care. If you have a high fever, take a paracetamol, bring the fever down, and then go to hospital. The worst impact is whereby there's self-medication at home, and by the time you get to the hospital, you're really critical. You've heard of those who've gone to the ICU and the doctors have already given the bad news is not easy. Breaking bad news is not easy, but by the time you bring them, they do maybe an X-ray or a CT scan or do some tests, and you find that the results are on the higher end, and then the life of the patient cannot be saved. So they just give the supportive management, but then they know shortly, within a week or a few days, the patient may pass away. And you know, a life has no spare, or there's no spare part or whatever. So a life is lost, which could have been prevented. So the negative side of it is if you self-medicate, the risk of losing a life. But if you do the initial remedy and then go to the hospital, because if you fall sick at night and you're not able to access the hospital, you know you have to rehydrate yourself, take fluids, bring down the temperature, and then as soon as possible, then you're then able to go to the hospital.
Mr. Emmanuel, under your capacity in the lab, I know it also plays a downside to the results that come out. If I take a paracetamol when I have had a fever, by the time I come to you, the paracetamol has done a job and sort of covered what should have been discovered under the laboratory. So please tell us about the negative side of this behavior of self-medication in getting the right treatments.
Yeah. You know, self-medication is a time bomb. Many people are trying to treat themselves, and I mean, people are treating themselves with all sorts of things. Once they develop symptoms and they feel it could be something, I mean, it's important that I told you it's a time bomb, because now we have what's called antimicrobial resistance. The drugs, you realize that there are certain drugs not working anymore. You take a certain drug for a certain period of time, the required time by the doctor, and it's not working. So antimicrobial resistance is something that is again coming up. The antibiotics that were discovered years back and were very good for treatment of people now are no longer being efficient.
That's very true.
So
yeah.
that's one of the things that is really, really so bad, and people really need to, once you find yourself having certain form of symptoms, it's important to run to the nearest health facility so that you're given the right drugs, and the right course of treatment is done, so that we do not develop this into another problem where we do not have antibiotics to treat people. Again, you know, just like you were stating, it's important not to wait for these symptoms. You know, now the way our lifestyle has changed is that we are beginning to see non-communicable diseases coming. And these, of course, you've heard that the people who have died mostly out of COVID are people who are having either diabetes, pressure, out of the lifestyle we've adopted of late. And so it's very, very important that on an annual basis you do some form of checkup, know how you are. You know, many of the labs now in town, just like MILDMAY, we do annual checkups.
That's the full body checkup. Full
body checkup. There are certain indicative tests that can direct or indicate that you have certain forms of infections developing. So it's important that we check ourselves more regularly, and we do not have a time bomb. I know of colleagues of mine who, out of the sudden, because they were taking treatments at home, eventually they lost their legs, you know, because again, I know one colleague of mine who was taking treatment thinking they probably had malaria for over a long period of time. And after a while, we discovered this person had diabetes. You know, if we had quickly discovered this, we would have been able to treat such a person.
Earlier.
So it's important. There are certain diseases that are prone to a certain class of people. If you are above 40 years, at least as a man, make sure you do your PSA test and know that you know, you're not developing prostate cancer. If you're a woman, it's important to do the cervical cancer testing. And many of these tests you can do, and it's cheaper when you do them when you haven't started developing infections. So besides modifying your way of life, it's also important that on an annual basis, at least you do a checkup. And I think MILDMAY is one of the places that has an annual wellness checkup for people who would want to know how they're doing.
Dr. Doreen, you'll give us that that service detail. But Emmanuel has brought it out in such a way that it's medical and it's right to do. However, if we are engaging faith leaders in this conversation, in ensuring that we fight and put an end to COVID-19 in the country, the element of faith is going to come in. Why should I go for cervical cancer checkups? Why should I go for prostate cancer checkups if I don't have it right now? It's more or less from the faith perspective. It's like I am saying that I intend to get that. So, Mr. Tadeo, what's the treatment to that mentality in the public right now?
I think the very important question indeed, because people will ask, why should I do a check if I am not feeling fine?
If I'm feeling fine, why should I do a check?
Yes, I'm feeling fine. Why should I do the check? Even the cost of prices has gone up. I mean, I should put my funds somewhere.
And then I get there, and Emmanuel is telling me, for you to get this result, you must first do this test, which really makes the price go higher.
Now, one of the things that is very important in healthcare is to make sure that you reduce on the amount of time you'd spend in terms of managing a given occurrence. And what Emmanuel is pointing out is that the earlier you do the test, the better in terms of management. We've seen situations whereby somebody has gone to test for cancer, say for instance cervical cancer. And you know, we've just finished a camp, an outreach camp with Rotary Fraternity as a hospital, where we offered all those kinds of services free. Now, you know, with cervical cancer screening, it's very important for you to get to know early enough, because we've seen that if you get to understand that I am at this stage, the management actually becomes quite simpler, as opposed to only being told when you have reported another case, another situation. When they come to diagnose you, they actually realize that you have maybe you are at an advanced stage of cancer, which cannot be saved. So it's very important for you to get to be tested. The other aspect that you asked is about the faith leaders. Now, from the perspective of COVID-19, we realized that the involvement of the faith leaders, even at vaccination level, even at testing level, became quite inspiring for the rest of the people. For instance, among the Muslim communities, thank you so much, the Sheikh of Luero, who is the district card there, he mobilized a very big outreach, and that outreach had over 500 people. And these were leaders, the Muslim community leaders. Now, when they saw the district cadre getting vaccinated, they all went into vaccination. And they said, yes, now we know that the vaccine is authentic. We have seen vaccination drives in the Diocese of Mitiana. We have seen here our own Archbishop. We have seen the Catholic community organizing sessions. To them, actually, they have gone further, that every service point, they are able to encourage people. So that when you go for prayers on Sunday, instead of walking to the facility on Monday, you come and get the vaccine when you have come for prayers. Now, what does that say? It means that we are looking at both the body and the soul. So it's very important that when somebody comes with hope, because also the faith leaders also deal with counseling.
Right.
A lot of counseling, people call in so many times and they're asking for the solutions. And once they are counseled, we must make sure that the faith leaders have the right information.
Okay.
So under this arrangement is actually when the faith leaders are able to lead and tell them, according to the signs that I see, you need to go and do a COVID-19 test. But also, if you're positive, they will come back people in the community. In the first lockdown, or actually the first wave, there was a lot of stigma. If you say that that person has healed of COVID-19, every person would want to run away and say, I don't want to associate. Now, that is about a town setting. What about in the village? What about if somebody has died in that family? What happens? Most people would want to say, that's not our issue, that we should run away from it. So the faith leaders are able to say, no, look, this is the situation. We need to keep our social distance. We need to welcome back the people who have healed of COVID-19. We had a case where one of the choir members in one of the associations, faith associations, got COVID-19, got healed, and came back. But some of the choir members didn't feel that they should be near this person until when the faith leader said, no, actually he's healed of COVID-19, actually give us a testimony. And those testimonies have helped people to come back and say, I can get tested for COVID-19, I get my treatment, after that, then I go back and continue with my work.
All right.
So it's a two-way.
And that is the testimony when you engage faith leaders and technical teams in regards to fighting COVID-19, but also to continue the message of hope, which is through vaccination, testing regularly, and making sure that you are actually having a healthy living. But I'd also like to take a message of hope from Dr. Doreen. I'll start with you.
Maybe the message of hope I would like to give the public is that according to science, according to public health, prevention is key in managing all conditions. So in relation to COVID, the mainstay of prevention is vaccination. So we should endeavor to ensure that we get the full scope of, or the full range of vaccination, depending on the vaccine you've gotten, maybe first dose, second dose, and then boosters. And then not only the adults, but also the children. A number of people fear that when you get vaccinated, they think of the worst side effects. All drugs and vaccines have mild, moderate, and then severe. But you find that those who get the severe side effects are the minority. And probably when they get those side effects, they need to go to hospital and be managed. So vaccination is key.
And when do you have the vaccination drives at MILDMAY, Uganda?
The vaccination drives at MILDMAY, Uganda, we vaccinate every Monday and Tuesday, as long as we have the vaccines from the districts. So we encourage people from 8 a.m. to 11 a.m.
All right.
So we encourage, my mainstay is that prevention is key in preventing the pandemics, and even in this season, if we wear our masks, wash our hands, sanitize, social distance, vaccination, and ensure that we're having a healthy living, right diet, doing exercise, we are able to get this disease under control.
Okay. All right. Mr. Emmanuel Amonyi, what's your message of hope to the Ugandan watching us today?
Thank you so much. My message of hope is that COVID can be cured. Like we've seen so many people get healed after knowing that they are positive. We should not have fear to test for COVID-19.
Okay.
Please walk to the nearest health facility that is accredited. Just like MILDMAY is one of the accredited facilities, but also accredited do other tests. Because COVID does not only, we don't only do COVID testing. Once you're found with COVID, you need to do other tests. And so it's important to work to a facility that is licensed to be able to do that, but also accredited to do that. Not many facilities are, but although I see, where there's money, people want to do everything.
They just put the signpost at the entrance,
so many facilities with
testing. And then you get to the ministry or you get to the passport office and they're telling you it's invalid.
Yeah.
Yes.
Yeah, and so your health is your wealth. I know we've talked about the issue of costs. It shouldn't worry us. At least there are public health facilities where you can be able to do this COVID-19 test free. Okay. And so please walk to the nearest accredited facility, not any other, and get the test done. MILDMAY is an accredited facility and does that test. And so please walk to MILDMAY. We do both private testing and public testing. So please walk in and get the service. Because once you're tested, then you are available. You can imagine many people lost their lives and they would be here supporting their families, and you'd say, oh, it's a costly thing to do COVID testing. Please walk to the nearest health facility, have your tests done so that you have wealth in terms of health for your family and for yourself to be able to meet your expectations in life.
Mr. Tadeo
Thank you.
Atkura, what's the way forward? 6 episodes, they're done and dusted. But what's the way forward in terms of message of hope to the Ugandans that we won't have that drastic surge again in Uganda?
Thank you, Regina. I think the way forward is for us to observe the SOPs. Let's not be complacent. Let's have our masks on. The ministry, yes, has announced that there was a point when we can, you may not wear your mask, but also they said in 2 meters distance, but also you must have been fully vaccinated. So it's very important for us to observe. But also the other thing is that let's talk to our families. Talk to our families in terms of the SOPs, but also for them to understand that the COVID-19 has not gone. COVID-19 is still here, and it has adverse effects, both in terms of health, but also the economy, so many things.
Okay.
Vaccination, very crucial. Now for the other things, is we encourage people to call for any information for COVID-19 assistance, for support on 0800 111 458.
Repeat that number again.
The number is 0800 111 458.
All right.
So that you can get to be supported.
All right. MILDMAY Uganda brings you COVID-19 messages of hope, and each one of them has actually shared the message of hope. And it comes down to you need to take care of your faith, but also you need to take care of your body. The other message that we pick out of it is that prevention has always been better than cure. And finally, your health is your wealth. And so you've got to take care of your health in order to enjoy the wealth that you're making around yourself, you're creating for yourself, your future, your children, etc, etc. Well, it's been a focal conversation engaging with the health workers as well as faith leaders in continuing the message of hope and in continuing spreading the conversations of COVID-19 and the standard operating procedures, which we all know. We might have reduced on them, but please wear your mask. Ensure that you sanitize and ensure that you social distance as and when necessary. Well, it's been a good morning, and thank you so much for having joined us for MILDMAY Uganda Talk Show. I believe that you have picked up 1, 2, 3. Go to their hospital. It's on Entebbe Road for more services in other health entities, and you'll get to enjoy the services. And they've also encouraged you have those annual checkups with your body, so that just in case of anything, it doesn't get you unaware, as they call it. Well, have yourselves a good afternoon.